Alrighty. Ready to get started, Robyn?
Sounds good.
Okay, well, thank you everyone for joining. I'm Angela Johnson. I'm the founder and co-CEO of Coalition of Black Excellence, and we are so excited to kick off our very first virtual chat. So to say these are difficult and trying times right now for the Black community is really an understatement. We are constantly dealing with difficult decisions about our health, our jobs, our social lives, our families. And then when trying to cope by going outside and getting out of the house, we feel added pressure about just engaging in mundane activities like jogging or bird watching. So these are difficult times. So we decided to start this COVID virtual series to try and play just a small role in making sure that even in our isolated circumstances, we still have a sense of community, access to experts and resources, and just an overall sense of support. So that's the purpose of this series, and excited to kick it off with you all with this mental health topic. Some quick housekeeping. If you are dialing in, if you wouldn't mind turning off your video so that we can allow everyone to just see the speakers, that would be great. If you have a question, feel free to chat me the questions that you have throughout this this session, and then we'll go through questions in the end. But you can send me any thoughts, questions, ideas that you have. And I think that's it for housekeeping. So without further ado, I'm excited to kick it off. Oh, and also the session will be recorded as well. So without further ado, I'm excited to kick off this series with an awesome panel covering arguably the most important topic, our mental health. And Robyn is our CBE mental health and wellness track lead, is going to be moderating the discussion. So Robyn, you can take it from here.
Thank you, Angela. So welcome everybody. I think Angela very much set the tone for why today is so important. So I'm pleased to get into the discussion because I'm the moderator. I know we have a lot to cover, so I want to make sure we have time to hear from the experts. So I'd love to start by introducing our esteemed panel that you see in front of you. And I'm going to start with Dr. Melissa Briggs-Hagen from the Centers for Disease Control and Prevention. Dr. Briggs-Hagen is the medical officer at CDC, currently serving as the Care and Treatment Branch Chief for CDC in South Africa. She's board certified in internal medicine and pediatrics, and first joined the CDC as an epidemic intelligence officer in 2011. Since that time, she has been largely focused on global health and infectious diseases, specifically malaria, TB, and most recently, HIV. She's been based overseas since 2016, first in Mozambique and now South Africa. And in her current role has had the opportunity to work with South Africa on their response to the COVID outbreak. Given the circumstances, she is currently home in Virginia and is becoming more engaged with the COVID response here in the US. And Dr. Briggs, as she'll share, is passionate about health disparities and finding ways to counter these through her work. So thank you, Dr. Briggs-Hagen, for being with us today. Next, we have Dr. Christine Wachira of Stanford Health and ICE Africa. Dr. Chris Wachira oversees clinical outcomes for neurosciences at Stanford Healthcare, is a fellow at the Stanford Center for Innovation and Global Health, and serves as the executive director at the Institute for Clinical Excellence Africa, also known as ICE Africa. Her clinical practice is focused on utilizing improvement science to develop strategies targeting poor clinical outcomes. Chris utilizes her diversity of knowledge and experience to foster equity for women and communities of color. So thank you, Dr. Chris, for being here as well. And then last but not least, we have Dr. Brenda Tucker-LaRue, who's a clinical psychologist. Dr. Brenda has over 40 years of experience as a passionate practitioner in the field of psychology. She offers an eclectic therapeutic approach that provides transpersonal, existential, cognitive behavioral, and hypnotherapies. She works with adults and adolescents with a wide range of emotional and behavioral problems causing anxiety, stress, depression, and relationship issues. So thank you, Dr. Brenda, for being here as well. As you can all tell, we have a highly esteemed panel, very specialized and experts in their field, and very much representative of the Black excellence that we like to see at CBE. So thank you all again for sharing your time. For those of you who are joining too, don't worry about having your camera on. You can put your mode in speaker view too. So I want to get started. I think, we're about 2 months into kind of really the forefront of the pandemic, at least here in the United States, especially in the Bay Area. And I think it's important if we're going to have a discussion around, mental well-being with regard to a pandemic. It's helpful to talk about, the current state of COVID and what are some of the data and statistics. So I'd love to start with you, Dr. Chris, if you can walk us through some of that data and statistics around COVID-19 cases, specifically how it's impacting those of us in the Black community, and let us know what we should take away from this data.
So thank you, Robyn. Thank you. Thank you for those of you who've joined us, for joined our discussion, and for CBE for having me. We are certainly living in challenging times, and the inequities that we continue to experience as our community are just tremendous. So I'm really grateful for these forums for us to discuss it. So when it comes to COVID-19, the Bay Area trends unfortunately continue to mirror the rest of the country. They've been reported very heavily on in the news. And African Americans are more severely impacted, even in communities where we are very lowly represented, even here in the Bay Area, in terms of the population. So for example, in Santa Clara County, African Americans are at about 3% of the population, and we account for about 7% of the case count, which is, and Santa Clara is one of the large 5 Bay Area counties that is sort of publicly reporting their demographic data. And so at 3% of the population, we show up at 7% of the case count. And anecdotally, we see this disparity, such as Santa Clara County, continuing across other counties. The reason being African Americans are heavily represented in the roles that are deemed to be sort of frontline. We end up being in the caregiving field, we're in hospitals, in nursing homes, in home health agencies, where we see ourselves in the grocery stores, as the checkout clerks, we're bus drivers, we're sort of the customer-facing, the forward-facing roles in the community. And that's why we see some of these statistics, local statistics, continuing to mirror some of the national ones. And then on top of that, we do have sort of the exacerbating factor of sort of a continuing mistrust in our community of the healthcare industry, where we find that African Americans are less likely to seek care from sort of the ambulatory or outpatient facilities. We tend to fight out the disease at home. So if you feel sick, we tend to try and fight it off at home before we show up to an outpatient or ambulatory clinic. And then by the time we come into contact with the healthcare system, it tends up to be more of an emergency situation where we come into the healthcare system through the emergency rooms. And so again, a lot of this demographic data is mirroring what is going on nationally.
Yeah, thank you for sharing that. And you touched upon it too, as far as us showing up later. I've been reading some of the local news even, and they talked about that Black people are getting hospitalized at 3 times of the rate, largely because of that, because we are going home and then we show up when our symptoms are fully present or further serious at that point. So I think it's helpful to share that, because I think even when this pandemic started, there were a lot of myths around, can Black people catch COVID? Social media, people sharing we're immune. So I'd love to, turn it over to you, Dr. Melissa. Can you kind of talk about what have been some of those common myths that have been detrimental to the Black community when it comes to navigating COVID?
Sure, thanks, Robyn. I think the first one that you mentioned is one of the most important. When you go to CDC's website, there's a website called Stop the Spread of Rumors. The very first one is disease can make anyone sick regardless of their race or ethnicity. And so I think the fact that that's, the first rumor that they're trying to quell speaks to 2 things. One, I think there was concern early on about stigma and stigma related to this disease. And so we shouldn't try to pigeonhole that one race specifically is carrying this or spreading it. But I do think it also speaks to all of our susceptibility. And as Chris mentioned, the data has now shown that African Americans are at increased risk definitely for severe disease. So nationally, we've seen 2 times the rate of deaths among Blacks as compared to whites and 3 times as compared to Asians. So that's, that's stark. And we've seen this with other illnesses. I think some of the things that Dr. Chris spoke to are definitely contributing factors, as well as underlying medical conditions, such as hypertension, diabetes, obesity, all of these things that are found to be risk factors in other populations are within the US context at higher rates in African Americans. And we know that there's lots of things that underlie that as well. And so there's the relationship with the healthcare system, there's challenges with insurance, there's systemic discrimination that have happened to African Americans over time. So all of these things, when we have diseases that are disproportionately affecting African Americans, are having an impact. So it's important for us to recognize the impact on our population, but also what can we do to protect ourselves. So one of the things that I do want to make sure everybody's clear on this call is what are the symptoms, how is it spread, and how do we protect ourselves? So the symptoms, the most common symptoms are cough, shortness of breath, fever, chills, muscle pain, sore throat, and actually loss of taste or smell, which is a somewhat more unique one. Less commonly nausea, vomiting, or diarrhea. But it is also true that people can be completely asymptomatic and spread this disease, or before they have symptoms, spread this disease. And that's one of the things that we did not know early on that came out over the course of our knowledge about COVID. And it's really one of the things that has guided CDC's recommendations on face coverings and social distancing. So this leads me to one of the other myths that I think I want to clarify on this call is around face coverings. Lots of people think you put on your face cover because you're going to protect yourself. Even still, it's just intuitive that I'm going to put on my face cover so I can go out there and be safe. That's not why CDC recommends face covers, at least not cloth face covers. For healthcare providers that are using surgical masks and N95 masks in those settings, they are recommending it to protect themselves. But the face covers, they're really recommending so that you are protecting other people. So it works best when everybody's doing it. If you go to a room that's full and closed in like this, and you have on your face cover and nobody else does, you are not protected. We want to make sure that everybody knows that it's really about everybody contributing to the safety of others. Hand washing, social distancing, not being in spaces with people who aren't protecting you are really how you keep yourself safe. We as African Americans are again, seeing more severe disease. So I hope that we are taking it seriously and doing all we can do to protect ourselves.
Yeah, thank you for, I think, very beautifully explaining that, because a lot of us think, okay, I wear the mask, I'm protected, I'm invincible. So I think it's helpful to understand that it's up to the collective group of whoever we're around, especially in grocery stores and running our essential errands, to protect ourselves and those around us. So very good point. I think you were, or it helps me segue rather into kind of the next piece. So let's say you are exposed despite taking all necessary precautions. Can you talk a little bit about who should be tested? When should we be getting tested? Asymptomatic? Do we need to go that route? And then a little bit even around handling if you get that positive COVID result.
Sure. So testing has definitely been a very, I think it's something that's in the media almost most often. It's a very complicated part of the equation. The first thing I would say is in terms of what do we mean when we talk about testing for COVID, because there's a lot of talk about testing, viral testing, antibody testing. Really, when you have symptoms and you want to know, do I have COVID? It's about doing a test that detects the virus. So these are called nucleic acid or antigen tests, or often talked about as PCR tests. An antibody test does not help you know if you are acutely ill because those antibodies don't show up for some time. And so they're more being discussed around workplace management, who can come back, et cetera. But CDC does not recommend antibody tests if you're acutely ill. So when we talk about testing, we're talking about these viral tests. CDC has put out national level recommendations on who should be prioritized. So they don't officially say these are the people that should be tested, because it really depends on test availability and then local guidance. So the people that they say should be prioritized the most are people who are being hospitalized, healthcare workers with symptoms, and people in congregate settings. So these are nursing homes and prisons with symptoms. So those are the top priority. And of course, those are people who have the most risk of transmitting other people, who have risk of being significantly ill. Afterwards, the next level of priority that CDC recommends is people who are symptomatic
or people without symptoms that are part of an investigation, like an outbreak investigation or some surveillance that the public health community is doing. So those are their kind of top 2 tiers, and everybody else, such as asymptomatic persons who maybe have a contact, are considered lower priority than those top 2 tiers. That said, each state and each locality has adapted that guidance to do kind of what they think is best for their state, again, based on the availability of test kits and so on. So California, I will go ahead and put into the chat for Angela to share. California has developed guidance that is posted online, and you can access it. I'm just sharing my screen now so that hopefully you can see it, but I'll post this link. But this is who does California recommend be tested, and they list here, just I mentioned for CDC, who would be prioritized. So I think it's useful for you to have on hand if you are worried about testing, what is the link for the health department in your area, so that when you talk to your provider, you kind of know what's recommended. You do have to, of course, speak to your provider. I think that's the first recommendation, is call your provider if you're worried. But to equip you with the information that you can go to them with, I would recommend you look at these sites and see what your state recommends as a priority as well. And there are slight differences from state to state.
That's very helpful. Yeah, I know I was talking even to my sister recently, because San Francisco, for example, has expanded who can get a test, and you just need one symptom, whether you're essential workers or not. And part of me wondered, not that I want to go through the discomfort of it, but, should I, out of curiosity, just kind of affirm that my asymptomatic status also means I don't have COVID? But, ultimately decided it wasn't a priority, I think, for me to go through that test at this point. So I like that there's a resource to even check, what priority am I, if I'm even considering getting a test, to discern whether you need to or not. So thank you.
Yeah, and just to add to that, I think part of the reason that there is this prioritization of testing is just because there haven't been enough available to test everybody, in the country, and so or everybody who might be a contact of anybody. And so when thinking about being tested, that listing is important, but it's also that the guidance, if you are asymptomatic, is often going to be to isolate yourself, to protect other people. And whether you have a test that shows that you're positive for COVID, or you're highly likely because of, the exposure that you might have had, some of that guidance is going to be similar. So I think when we get to talk about, what is the guidance for how you manage COVID, you can see why there's this prioritization instead of a requirement for everybody to be tested.
Thank you. So I want to maybe backtrack just a little bit and go to you again, Dr. Chris. You started to talk about, the disproportionate ways in which the Black community has been affected, our distrust. Can you maybe get a little bit more into that, especially for those who don't necessarily work in the healthcare field and aren't familiar with, social determinants of health? Can you just kind of talk about what those disparities have looked like within the Bay Area?
Sure. So starting off, so historically, the African American community has been underprivileged. Or there's a lot of inequity as far as healthcare is concerned. We have a lot of pre-existing medical vulnerabilities, and those are sort of determined both on economic and social conditions that have, sort of pre-existed. So part of those determinants include sort of neighborhoods and what I call a reference as zip code disparities, where you have, certain zip codes being under-resourced as far as healthcare is concerned, where you have, you don't have access to either, activities that can promote healthy living, or resources that can offer you sort of healthy food varieties, right? So we have this sort of healthy food deserts within our communities. And then we also have a lot of the economic stability disparity, which which has to do with sort of income, where we find like most of our African American communities are heavily represented in low-income jobs, and those again tend to be sort of the customer-facing jobs or roles that are now like overtly exposed to COVID. And then we have sort of in the Bay Areas, really high housing costs, again, which sort of determinants to get into sort of multi-generational living situations where you have, grandma living with the daughter and the grandbabies under the same roof. So again, when we talk about, if somebody becomes COVID positive and they're supposed to social isolate, how do you social isolate in that sort of living environment? Again, then we have sort of the healthcare disparity as a whole. So access to healthcare in terms of sort of ambulatory and primary health centers. We have access inequities as far as healthcare insurance is concerned. We'll talk a bit later as far as sort of the job losses in California. There's a tremendous amount of job losses sort of projected in the month of May, over 800,000 jobs lost. So for those of us in our communities who may have had health insurance to start off, we likely don't have that right now. And so when you're talking about some of these comorbidities that are sort of making us so really, really heavily impacted by COVID, comorbidities such as diabetes, asthma, obesity. When you have a diabetic who lost their job, has no insurance, and they're insulin dependent, and their unemployment check hasn't been processed yet because of the backlog and the delays in the system. I mean, a lot of these issues exacerbate sort of the COVID impact in our community.
Thank you. Yeah, and that was one of the questions that I had too, when we're talking about job loss, and then you hear, being poor is almost a pre-existing condition in itself. And if you don't have the economics to support yourself, especially in a city like the Bay Area, are you becoming even more susceptible to, the health issues that come along with COVID, and also managing all of your other potentially pre-existing conditions that you had. So yeah, I think in the Bay Area, yeah, Dr. Briggs Hagen, did you?
Yeah, I just, coming from my setting in South Africa, the access to the challenges with African Americans and access to paid leave and even the ability to telework are really substantial. I mean, when you, in a lot of countries in South Africa, lots of the health sector, or lots of the, public sector do not have jobs where they, are able to work from home or have the ability to get on Zoom like we're doing now. I mean, it's kind of in the 30-50% of the population range. So I think the Bay Area is a little bit lucky compared to other parts of the country in some ways that maybe certain parts of the population did, but there's a lot of people in the country who just don't have access to that freedom. So I think, Chris, what you pointed out around job loss is huge, but even just the ability to work from home, it's just not there for a lot of people.
Yeah, and it almost sounds like, being faced with the risk of continuing rather your frontline role, right? Where maybe you have these underlying health conditions, but you can't survive without working. So what do you do? And I think a lot of people are being faced with that tough decision, a lot of Black people in particular during this time. So I think, yeah, you all appreciate have set the tone around just understanding how this has disproportionately affected our community. I kind of want to transition a little bit then to, I guess when you have COVID, are there approved courses of treatment? You touched upon, Dr. Melissa, mask usage. I think there's even some, politics around that, right? Wearing a hoodie while Black is a challenge. So wearing a mask while Black, what does that look like? But can you talk a little bit about, the treatments, and again, a little bit around the protection from COVID?
Yeah. So, I mean, I think this is also a bit of a tough area. I think that as we look at the data and we look at the death rates among Blacks, how do we improve outcomes for African Americans, I think is a huge question, and definitely recognizing the symptoms, following your symptoms and getting care earlier is needed, but it's not always easy to do. It takes some self-advocacy, I think. So I think that's part of the reason for this call, to try to equip you with how do you advocate for yourself. In general, the data that's out there from China and from other countries have shown that about 80% of people will have mild to moderate illness, most of whom will be asked to take care care of themselves at home. And there's good documentation of the things that you can try to do to protect others while isolating at home. And I think, but Chris spoke to some of the challenges with that. And so people who have mild illness and do not need to be hospitalized will be asked to try to stay in a separate part of their home, to wash their hands frequently, to wash surfaces frequently, to wear a mask if they're around others, to socially distance within their home. And that's really the main guidance in order for them to protect other people, and then to let their body overcome this on its own naturally. That said, there's about 20% of people in some studies that have developed severe critical illness, and that can happen quite late. So whereas most viruses, you see 3 to 5 days, you start to get better. If it's 7 days, you start to wonder what else is going on. With COVID, that's not been the case. The people who have gone on to have significant respiratory illness or have gone into ICUs have often gone in between day 8 and 12. I think what's important is to know that even if you've been doing okay for some days or you thought you were getting better, you have to stay rigorous about monitoring your symptoms. If you're feeling more short of breath, if you're starting to feel confused, if there's anything that's really changed that makes you worried, seek care. And if it's one of these emergency signs, go to the hospital. Put on a mask, call them if you can and tell them you're coming, but go there and make sure somebody evaluates you and listens to your lungs and checks your oxygen and sees if you're stable to go home. I think, for those emergency signs, there's nothing that can be done on the phone. That does require in-person care. Treatments are complicated. There's no FDA-approved treatment at this time, so most of the care is supportive. It's oxygen, it's IV therapy, it's stuff to manage your symptoms. But there are, of course, these investigational therapies, and a lot of them you've heard about on the news. So for this, CDC does not oversee that. It's really FDA, NIH that's doing the investigations, FDA that does the approval. What I would recommend is that if you have a loved one or yourself that's going into the hospital and you want to know about what therapies are possible for you, that you actually go to the FDA's coronavirus FAQs page. So I will send that out as well. It's a source of information that I go to say, okay, it actually has some of the evidence behind why was remdesivir, which is a drug that's been in the news a lot, given that it's emergency use authorization? What's the data behind it? Does it work? So they have these questions there. Again, I can share this page very quickly so you just see how it's set up. But take a look at it, and that will help you have hopefully a better conversation with your provider about, is my loved one or am I eligible for this treatment?
Thank you. So I know we've definitely, COVID obviously affects your physical body, but we would be remiss, right, to ignore the angst, the anxiety, the mental distress that goes along with just navigating, again, the pandemic. So I definitely would love to hear from you, Dr. Brenda, if you can talk a little bit about, how is COVID-19 affecting our mental vitality, even within your own practice? Are you seeing that increased need for mental health support during this time? Can you talk a little bit about that?
Yes. How are you doing, Robyn? Thank you.
Thank you.
My clientele is like from age 14 to 60, and it depends on what age cycle you're in. So the younger ones, it's a sense of isolation, not necessarily impending doom, but a sense of isolation because our identity is wrapped up in how others see us. And so if we trapped inside, we don't have that social process that's needed. And so I'm getting a lot of younger people who are going through a lot of anxiety and depression in terms of who am I and why is this happening, and trying to figure things out, and if this is the end of the world or how the world is going to be. And then you have those who are starting their career, restarting their career, starting their families, a new job, whatever. And many of them, this has hit before, back in 2008. You've gone through college, you got your education, you have your graduate degrees, you're starting in terms of your journey, in terms of your career. You think your feet are solid, you just bought a home, you're thinking about the next phase of your life, and boom, here this comes. We have to remember that in this process, it's a repeat of what African Americans have had to go through over and over again. You know, it go back to my years in terms of being a Panthers during the civil rights and how we had to rev up and take care of ourselves. You listen to your parents, whatever. I want to put this caveat in terms of my bio in the sense that I'm also a retired tenured professor from university as well as community college on both levels. And I'm saying that because psychology is very important in terms of helping people identify their issues and their problems and moving through it, but it's the educational part that helps us to really understand what's happening. You know, there's no more Santa Claus. So when you're going through a repeat of the pain and it's epigenetic, it's a process where you are feeling the pain over and over again. So for us, it's exponential. It's like it's 400 years times more in terms of what we are feeling. So when people are coming in, those people that's in that age range I just mentioned in terms of trying to get started and all of that, it's like the depression and the anxiety, it's overwhelming. They are trying to figure out what to do next, if they can do anything next, but most of all, they're grieving. Why is this happening? Why am I going through this? I did everything I was supposed to do. I followed the rules. I played the game. And now I'm back in being the last hired and the first fired. And that's those of us who have an education. Those of us that are not, have a particular skill or trade, well, you know what happened with them. It's just been mentioned in terms of those jobs have been eliminated or they don't have the resources that they need to have. And there's a historical aspect to that too. But the other part is that you have the older ones. Now the older ones, their issue is they have been so busy running, as well as the younger ones. We have been so busy on this treadmill. This is one country that everything is moving. And we never take the time to stop and just deal with us, just deal with who we are and our issues, knowing who we are. You know, so we have all these things that take the place of loneliness, all these things that take the place of emptiness, all these things that takes the place of the need to have love or self-love. And when all that is taken away from us, like COVID, is not so much a fear of getting the virus. It seems like it's more of a fear of, is this how life going to be from henceforth and I'm alone? So that comes up a lot. The older ones, they're busy now clearing, decluttering. They're having some issues about loneliness. They're having some anxiety about what to do next, but they're in a position where they have a reference point where they can sit and look back and begin to start thinking about what is really important. What is this about? What do I need to give back? They have a reference point in terms of what they have accomplished. When you're in your 20s, 30s, and 40s, you don't necessarily have that yet. And so the fear is greater.
Thank you for that. Yeah, so I think it's interesting that you're sharing there is that common trend of, you know, isolation, varying degrees of fear based on what life stage you're in. And I think something else interesting that you mentioned is that this isn't new to COVID. You know, we've been dealing with this for years, and it goes back, you know, 400 years if you want to, you know, take it there. And we kind of talked about this a little bit yesterday, but I'd love to just think about, you know, given the tragic news that's it's been in the past 2 weeks now with Ahmaud Arbery, Breonna Taylor, and then we were talking about just yesterday with George Floyd. What are some of the resources then that we should be looking to implement to manage stress and anxiety? So the stress, angst that comes with, okay, we're dealing with COVID, we're, you know, isolated and separated, and still dealing with all of the issues that come along with being Black in America. Is there anything we can do? I mean,
well, you know, our first thing is one of our main issues have to deal with, which makes us seem as though that we have mental illness, which we really don't. We're just in a mentally ill environment, is anger. What do we do with that anger? And that anger, it magnifies, and we don't really know when it comes out. It just comes. we don't take time to sit down, and we need to have someone like a therapist or a counselor that we could go to and talk through our anger, to deal with the source of our anger, which probably could be the fear of what tomorrow is going to be, or how I'm going to pay my rent, or any of that. We need that. Now, in the European culture is quite individualistic, so you have psychotherapy, psychoanalysis, etc. But in all other cultures where there are melanated people, we operate in terms of groups, in unity. So we come together and we bring love. We bring non-judgmental concepts into our groups. And I would like to see men do this even more, informally, to talk about what is going on. Now, just talking about it obviously is not enough, okay? That's the first part. We have the beginning in the sense of talking about it, marching or whatever, but there's this long term. What are we going to do to prevent this from continuing to happen as it has happened for hundreds of years? We have people who are now in place in terms of this generation. They have the education, that have the background and the experience to begin to develop again, because we've done this before many times in terms of our Reconstruction age, our own base. The reason why we're going through all of this at this point, a lot of it has to deal with economics, okay? We, again, no job, can't pay the house note, whatever. Somebody in charge is determined whether I'm going to be hired or not. Now, with all of the professional groups that we have not built an economic solid base. When we get together to talk about, and we need to grieve, you need to take time to grieve, and I'll deal with some basic stuff like how to breathe and meditation, Pilates and yoga, taking a walk, being organized, making sure when you get up in the morning that you have a routine, thinking positive, having clarity about what it is that you really desire, and then begin to start putting that emotion in your mind and in your feelings, in your body, what you see and what you would like to have. Begin to imagine it happening, and then begin to start living that. That's another process you will begin to see happening. But in terms of what you were speaking of just now, I'm sorry for getting a little bit off. Not only do we need to come together with love and unity and understand that one group is not better than the other. I don't care how much education or money you have, that just means that you have more to give back. We all are in this together. We need to begin to have a strategy, and it need to be we need to be in an environment, or do it, if you haven't heard of the spook who sat by the door, in a way where it's undercover. We need to come up with plans in terms of how we're going to make it through this pandemic. We know that we have to operate also outside possibly of this country, and you have the capabilities of doing that. You may have to do other things until you get exactly what you want. You may have to do substitute teaching. You may have to, there are things that we all have done that we felt that we didn't need to do because we were more educated than that. But you have to do what you got to do to survive. So who you are and how you represent yourself, that's great. But at the same time, you can't be too proud that you don't take care of what you need to do in terms of your family. But with that, we have everything that we need, because we create everything that everybody copies. Everybody takes what we take and run with it, to begin to start now planning and organizing, so that this is going to happen again. Something else is going to happen again another 10 years, because every 10 years or 20 years something happens. We have African Americans have a 20-year space of time, and look like the doors open for us for about 20 years, and then it shuts down because we get caught up in taking the dollars, taking the gratitude, taking whatever, and forgetting that we need to do things for ourselves. Now, breathe. Take a moment to do some deep breathing. Understand that you need to calm down so that you can connect with the source. Where is the source? The source is in you. And when you begin to focus on that and structure that in terms of being part of your daily routine for at least 3 or 4 days, you'll begin to see the difference, that things will begin to happen on your behalf. As a brotherhood, as a sisterhood, we have to begin to start coming back together as a family in unity and in love, so that we can move through these next 20 years, because we're going to be okay. Those of us that are here, you didn't come here to be at this point in time and there's nothing for you to do and that you're not going to make it through. Not only are you going to make it through, you're going to make it better for everybody, including your kind, because you know there is Black generosity. Whatever we do for us, we're going to do for everybody else too. So that's part of what I think should be the practice and the remedies of us coming together as a unit, to know that we can't just dwell on what has happened, what has been happening. It hasn't changed. We march, we march, we march.
Yes.
And then we back at the same place. So we got to start coming together. And that's why I love CBE, the concept, because I see that as the base in terms of a lot of fabulous things starting for a coalition of Black excellence to come out of that could be nationwide and international. So I've used up all of my time. Sorry.
No, I want to make sure you said so many great things in there. So what stood out to me within that is, as we're dealing with all of this, right? First is talk to your therapist, talk to your medical providers, right? You're not alone. So don't forget that there are resources and professionals who can help you navigate this challenge. So I think that's key. And, you know, it is Mental Health Month. There's even statistics around the time of symptoms onset to 11 years later is when most people first seek treatment. So you're talking about every 10 years something happens. Don't wait until it's been another 10 years to get the help, you know, start today and, you know, figure out who you can connect with. I think you also shared it's important to make sure you are grounded and, you know that you have the source, the resources, the community within you as well. So I just wanted to highlight that it's definitely key. And then to breathe, you know, those basic practices, you can do that within your work chair, throughout your work day, with family and friends. So you are not long-winded. Just appreciate you sharing those tangible tools, because we need them, especially now.
Okay, yeah, I want to say this too, and that is, I didn't dwell on the fact in terms of seeking counseling and therapy. I'm glad you reiterated that, because the pain is there. The pain is there from birth. I mean, it's there. It's there when you get your first job. It's there. So we need it on a regular basis. We don't need to wait the 10 years.
Right. Thank you. So I know we want to leave room for questions too. So I think just my final thought or question for all panelists, if you could share, you know, what do you want us all to leave with? We just left Memorial Day weekend, where you could see various groups around the country getting together as if COVID disappeared. So, you know, can we talk about, is COVID still here? What do we need to be doing to make sure that, you know, we can come out of this stronger? What should we all take away from this very short talk that we could probably keep having for hours? So whoever wants to start, please.
Sure, I can go. And so things that I forgot to mention earlier when I was talking about treatment symptoms and risk is that there was a study in Georgia that came out last month that showed that 1 out of 4 of the people that were hospitalized didn't have any underlying risk factors. So they weren't elderly, they didn't have diabetes, they didn't have hypertension, and so on. And so I think I just want everybody to stay safe, you know, to recognize that anybody can be at risk. There's still a lot we don't understand about this disease. And if 1 out of 4 people that were hospitalized there didn't have these risk factors, likely many of them felt that they just, oh, if I got it, I'll be fine. I know I've thought that before. Oh, if I get it, I'm not worried. I'm just worried about my parents or my mother-in-law. So, but we're learning more all the time about this disease. So protect yourself, stay safe, and be equipped to advocate for yourself and your family. Like, you know, and when I say be equipped, I don't mean constantly watch the news, because I do think, I don't know, Dr. Brenda can speak more to this, but I think that the 24-hour news cycle and all of the agendas that are at play there are not healthy. So, you know, stay up to date on the news, but go to these websites that I'm sharing, like know the information yourself, so that when you have conversations with your health providers or when you need it, you, you know, you're equipped.
Thank you. Dr. Chris.
But so thank you for reiterating that, Melissa. That was really important. I think the equipping yourself with knowledge, information, and so you can protect not just yourself, your loved ones, but also your neighbors and your community. Dr. Brenda just she talked about pivoting, you know, and thinking beyond. So if you've lost your job, think beyond what you were doing and try to figure out how else you can, you know, improve, what else you can do to sort of earn a living, what else. You're not alone. We're all in this together. Stay safe, adhere to the guidelines that are coming from our local government, and let's stay strong as a community. We have a lot coming at us, coming against us. Let's just stay strong as a community.
Yeah.
Thank you.
Yeah, and doctors, I would like to say that many times we talk to the choir, and I am experiencing a lot of young people from here to Georgia, a lot of them are young men in their early 20s who don't believe the pandemic, or they have given up and feel that it doesn't matter. I don't know quite what the reason is, but I do have a fear that we're going to lose a large portion of a certain demographic, and that would be the younger ones. So I just hope that somehow with our resources and abilities that we can reach them. They're dealing with a lot of theories that are not based on necessarily the truth as we know it, but they are preferring to believe those theories. And as a result, they're just living their life as they want to and not being concerned, and they possibly are being symptomatic and contaminating other people. So, you know, I just hope that all those that are listening will reach out to their young people, especially their teenagers and those that are in their early 20s, to impress upon them how important it is to be aware of this pandemic, that it is real, however it came about.
Thank you. Thank you all. So I think this was very helpful. We have enough time to see if there were any audience questions that came in. I don't know if Angela wanted to pop back on, but while we're letting maybe some questions come to mind, just want to remind everyone that this is the first of the virtual chat series, so there'll be more topics coming up with each month. But as Angela mentioned, we wanted to start off with what matters most to you all, your health and well-being, and make sure you have the tools and resources to help us come out stronger on the other side of this. And we're going to definitely share all of those resources with you all, and please share them with your family, and, you know, let's protect each other and our community. So Angela, I'll maybe kick it back to you if you got any questions. Or
We didn't. We have about 10 minutes left. So if anyone, we have two ways. You can either send me a message, or you can take your camera off and I'll unmute you if you want to ask a question to our panelists. But yes, thank you all. This has been very helpful just to understand the myths and how we can protect ourselves as well. So before we end the session, any questions from anyone in the audience?
And thank you again, doctors, for your time and expertise today. It was very valuable, and I know we'll be sharing this recording, so thank you so much.
Story to Brand, Chantel.
So I just had, well, number one, thank you all for just taking the time to just share insight and be very open to with us and allowing us to be vulnerable in this moment. So this question is for Dr. Brenda. You mentioned putting together a plan. Did you have a way, a one step, two step, three step of just starting what that plan should look like as it relates to just building community wise, you know, any kind of insight you can just share based on your own personal experience.
Yeah, well, you know, one thing I would like for us to be, and that is learn how to be an invisible force. You know, in terms of the step-by-step, I'm not a business person or economist. I am reading up on that. There's a wonderful book out by Dr. Anderson that is talking about Black economics. But the first thing is Chantel, I would like to see our sororities and fraternities to begin to understand that it's time now to start building a base. It's time now to stop spending billions of dollars, giving it back into hands that will not hire us or give us a share of the pie. We should by now be able to have our own hotels, our own large restaurants, an island that we own in terms of resort. I know there's one or two people who have that, but that are of color. But in terms of a step-by-step plan, no, I don't have one as yet that I feel that would work. But you know, I am thinking about it and working on it. I would like for each one of the communities, in addition, to have something that is called like the Black Box, a think tank in each one of our cities, where Black intellectual scholars and others and community-based people and nonprofit folks come together and decide on how they need to move in their communities. We can start by just simply saying that we're only going to spend our money in certain places. You know, it's not a very complicated thing, because we have to gain power, and we understand that this country, the money is their God. And so if we want to have any kind of power, because it's about power and resources, then we have to pool our resources together in order to gain those resources. And resources is basically what comes from the earth, what comes from the ground and people. So that's a roundabout way to say, no, I don't have the structure yet, but I have ideas. Good question, though.
We just got a question in. Thank you, Dr. Brenda. And thank you, Chantel, for the question. This is probably directed to Dr. Chris and Dr. Hagen. School districts are beginning to announce that they will be opening in the fall. How can they protect students and families with social distancing guidelines? Children in particular, adolescents don't, as a rule, understand keeping distance from their friends. How will they do this when they haven't seen them for months? So can you talk a little bit about the impact with children and ways that we can address that?
That's a great question. I was just listening to the governor yesterday talking about, sort of rolling into sort of the level 3 and 4 stages of, so California has this sort of 4-staged rollout of opening up, and talking about opening daycare centers and schools, and they're going to be issuing very specific guidelines as to how to make that safe. I know there are certain systems such as the CSUs, they've decided they're not going to be opening any of their college campuses in the fall. They're going to have all online classes. That's going to continue through to 2021. So I do know, I have not seen the guidelines that were supposed to come out today, the specific guidelines as to how the schools and sort of the daycare centers type of situations will be open, and how the local government should implement sort of the social distancing and the sanitization of sort of the shared areas is concerned. But there are definitely going to be guidelines coming out from the governor's office.
And can you also talk about, I don't know if Dr. Hagen, if you can talk about this, just what is the impact on children? Is there anything different, or should kids be wearing masks? There's a lot of, I guess, confusion around that too.
Sure. Yeah. I mean, I think to Dr. Chris's point, I think we can also share, there's a lot of information online about guidance around school reopening, because I think it's probably going to continue to evolve as these reopenings happen. But again, I think you should be having conversations with your teachers, your principals, whoever's planning the reopenings of the school, and getting the detailed information about what are their plans, what are their contingency plans. Are they going to make sure kids use face masks. How are they going to do social distancing? How are they going to disinfect? So I think there's so much out there that it gives you a bar that you can judge the program by. So this is the time to really engage in those questions and make sure that it's being shared clearly. And we know in general that children are less likely to have severe illness, but of course in the last month we've seen this multi-system inflammatory disease that's come up. Some people have called it a Kawasaki-like illness, which is a much older illness where many organs are affected from an inflammatory syndrome that's been around for a long time. It's quite rare. And so this new syndrome is also relatively rare, but I think it's been scary because it's coming often after a child has been exposed, and they may not have been symptomatic the first time. And so it's just the kind of the unknown that I think is fearful for people. I think the main takeaways as this is coming out, there's going to be lots of investigations to try to understand who's most at risk, and not the therapies for Kawasaki's disease work for this new syndrome. But the takeaway is to just be paying attention, and that if your child is starting to show new signs or symptoms that you are concerned about, to go ahead and seek care and to not wait, not to sit on it, and not to minimize their symptoms. So this is the time that we need to be engaged with our healthcare providers, just like we need to be engaged with our schools. This is not the time to do it's just home, let's figure it out, or wait and see.
Great, thank you.
So just one last thing. I want to just piggyback on what Melissa was just saying. As far as masking is concerned for children with certain age groups, it may not be safe for them to mask because of their inability to regulate sort of their oxygen carbon dioxide exchange. So please defer to your pediatrician or your healthcare provider and consult with them, just to make sure you're actually doing what is actually safe for your child before you start enforcing masking.
Yeah, absolutely. Definitely children under 2 should not wear masks. Please do not put a mask on your baby. Pictures of that, and it always makes me sad because I think somebody thinks they're doing the right thing. Do not put a mask on a child under 2, or if somebody feels short of breath with the mask on. So you're a person who's symptomatic and really short of breath, and if it makes them feel more short of breath, then don't do it. Those 2 are 2 groups that it's recommended not to put a mask on. Talk to your provider about your child.
We have another question around vaccinations and what is in the event that a vaccine is found for COVID-19. What's that timeline look like? Can you give more insight into sort of what we can hope for? I guess the best thing we can hope for.
I cannot. I am no more. I mean, I would be able to say the same things that you guys have heard on the news. The vaccine trials and all of that are managed more by NIH, and I've got no specific insight into it. Other than that, it's generally a long scientific process, and as you hear on the news, they're constantly doing things to try to accelerate it. But I think we will have to see that the phases of these trials, when they talk about phase 3 trials, it's still you're still waiting to see if it's effective before it can be rolled out. So yeah, I don't have any specific insight that I can share from my position.
Okay, great. We are at time. Any last words from any of the panelists or Robyn? Before we close out?
I would like to encourage people to get involved in organizations that's related to their careers. Start planning in terms of getting involved, being on the police force, being on the commission, the municipalities, all those things that control our lives. We can't live in an isolated way. We need to get involved in those things that are impacting us.
That is a great segue to my wrap up. So thank you all who have attended. As I mentioned in the beginning, this is the beginning of a series. We'll be circulating all of the resources, opportunities for you all to get involved with CBE and to tune into our chats in the future. So thank you all. And we'll have this recorded as well and distributed. Thank you all.
Thank you.
Thank you.
Thank you. Thank you.
Stay safe.